Okay, welcome back. Today we're continuing our BCBA exam practice question series, where we're going through a set of BCBA exam practice questions and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. We'd really appreciate it. We also have a membership option now, which will give you access to priority email requests and our Discord server. If you're looking for our proven study materials, check out bcbastudy.com for all of our practice exams and study guides. As always, let us know if you have any questions or comments. Work hard, study hard. Let's get to our questions. Question 1. You refrain from drinking margaritas during the week. By Friday, all you can think about are margaritas. This is most likely due to a what? Pretty straightforward question. Let's just break it down and think through it. So it's most likely due to what? And what they're referring to, of course, is this idea that all you can think about are margaritas. And what is causing that? Well, we know you refrain from drinking margaritas during the week. What are you doing to yourself? Well, you're putting yourself into a state of deprivation. And when we talk about deprivation and satiation, we're talking about motivating operations. In order to manipulate motivating operations, we'll very often use things like deprivation and satiation to either increase or decrease the value of a consequence. So this is most likely due to a what? A discriminative stimuli. Now remember, the discriminative stimuli is the stimulus which signals a consequence is available, because in the past that consequence has been made available in the presence of that stimulus. Just because you're thinking about margaritas doesn't mean you can have margaritas. If you're at school and teaching a class, margaritas are not available, but you can still really want and think about it. And that's why this is a motivating operation, and understand the difference between the two. The MO is going to make you want or not want by increasing or decreasing the value. The SD is going to signal it is available or not. Premack principle just says you can engage in a response contingent on engaging in a low probability response, Grandma's law. You're refraining from drinking margaritas, but there's no real contingency in place as far as we know. You're not utilizing the Premack principle of saying, if I get my grading done, then I get margaritas. No, you're just not drinking margaritas. So we're not using the Premack principle here. And then high P request sequence, of course, is using a bunch of high probability requests or commands, and then following with a low P request or command. Again, not doing that, simply using deprivation as a way to increase the value of margaritas later on. Right. So what are we doing? We're manipulating motivating operations. The reason all you can think about are margaritas are most likely B, motivate. James's daughter is sleeping in her crib upstairs. James puts his plate in the sink too loud, and his wife reprimands him for almost waking up the baby. James no longer puts his plate in the sink when the baby is sleeping. This is an example of what? Okay, story of my life right now. So when we get a question that asks for you to describe the example or describe the scenario, always pinpoint first, what example are we talking about exactly? What behavior are we really looking at? Okay, so let's break it down. James' daughter is sleeping in her crib upstairs. That's our antecedent. James puts his plate in the sink too loud, which is our response. And then his wife reprimands him for almost waking up the baby, which is the consequence. You would have to imagine the wife would not be as harsh if James put the plate in the sink when the daughter wasn't sleeping. That's not the case. That's why James's daughter sleeping in her crib upstairs is the antecedent, because right before James puts his plate in the sink, the daughter is sleeping. So the consequence for James putting his plate in the sink too loud is a reprimand from his wife. Now, what do we know about reprimands, consequences, punishment, reinforcement? How do we determine if a consequence is a punisher or a reinforcer? Well, we look at what happens to future behavior. And without knowing what happens to future behavior, it's impossible to truly determine the consequence, right? In this case, we know the wife reprimands him, which is great, but we're not quite sure yet until we read James no longer puts his plate in the sink when the baby is sleeping. So what has happened to James's behavior? James's behavior has decreased. What do we know about behavior decreasing? We know that behavior has been punished. So effectively, the wife's reprimand did function as a punisher. So then ask yourself, was the reprimand added or removed? Because if it was added, it's positive. If it was removed, it's negative. Well, we know the reprimand was added as a stimulus was added to the environment. The added stimulus caused James' behavior to decrease. So it added positive, decreased punishment. This is an example of positive punishment. That's how we should just walk through every behavior question. Identify the antecedents, the consequences. What about future behavior? Are we adding something, taking away something? And once you start getting really good at that, these questions become very simple and very straightforward. What we don't want to do is see the word reprimand and immediately think punishment. What if James's behavior increased? Then it would have been reinforcement, right? We have to look at future behavior. But since James's behavior decreased, we know it's going to be punishment. Which of the following strategies is not recommended during personnel management? All right, personnel management is tough for a lot of people, especially repeat test takers. The thing you want to remember is personnel management is essentially the same thing as client management. You want to identify goals and targets and reinforcers and maintaining consequences and antecedents and functions and everything else. You're essentially just writing treatment plans for your staff. So if you think about it that way, it becomes a lot more simple. So in this case, we want to know about the strategies used during personnel management and what strategies are not recommended. So A, covertly monitor your staff. Now, what does that mean to covertly monitor your staff? It means to sneakily or in a hidden way monitor your staff without them knowing. This is not recommended, okay? It can cause severe pushback on staff, right? Sure, you might reduce reactivity, but in the form of personnel management, we want to know and make the staff aware that they're being monitored, okay? You don't want to just covertly and sneakily monitor your staff. A looks like our answer. Do we pick it and move on? No, we read all of our answer choices. B, inform your staff when they are being monitored. Good, the exact opposite of covertly. So we know it can't be B if it's going to be A. C, provide immediate feedback to your staff. Yes, you want to provide immediate feedback. Think contiguity, okay? Closeness. As soon as something goes right, something goes wrong, give feedback, okay? Now, do it with dignity. Don't embarrass them in front of clients, right? But we want to be as immediate as possible. D, determine what is maintaining staff performance. Absolutely. One of the biggest mistakes people make in personnel management is they have a team that is doing what they're supposed to do and everything is going great, but we fail to realize or understand why exactly is that behavior going so well? Why is it maintaining so well? If we can understand what's maintaining performance, we can start to replicate that, okay, and keep that behavior moving. So, which of the following strategies is not recommended during personnel management? It's going to be A, covertly monitor your staff. Pretty easy question. Your first instinct was probably to pick A and move on. Don't do that. Never, ever do that, okay? One, we want the best answer. Two, when you're practicing and learning, you should be using the other answer choices as learning opportunities. Why are they wrong? Really sit there and understand why they're wrong. If there is definitions or words you don't know, look them up. Spend a lot of time on each question, really soaking as much information as you can from it, okay? So, again, following strategy not recommended. A, covertly monitor your staff. If you conduct a functional analysis on a behavior that has more than one topography, how should you approach the different topographies? What is the difference between the function and the topography? First thing you need to ask yourself. Topography is what it looks like, form. Function is why it's occurring. Responses can have hundreds and hundreds of topographies and function for the same reason. So a question is asking, if we're going to do a functional analysis where we're actually manipulating the environment to identify the function, what do we do when there's more than one topography? How do we approach this? A, assess just one of the topographies. Now, what if your response or behavior has 5 topographies? If we only assess one, is that really going to be the best way to determine the function of the other 4? No, you just can't. Think about holding your hand up, the palm of your hand up. You could be asking for a high five. You could be telling somebody to stop, right? Just there, it's 2 different functions, right? So we have to be careful about identifying a function across all these topographies. Assess each topography individually. Yes, ideally, if we have time and the resources, we would want to go one by one through the topographies and assess them functionally individually. Again, you hold your palm up. I'm going to assess that, okay? And let's say now you close your fist, okay? So 1 is to stop, not actually give a high five. Fist is a fist bump, Okay, different topographies. If we would have just said, well, every time I hold my hand out, I want a high five, that's going to be incorrect. Okay, so you want to assess each topography individually if possible. What about C, assess all topographies at once? That just doesn't seem possible for most behaviors. D, you cannot conduct a functional analysis in a situation. Of course you can. You just might have to do a little more work, and you're going to have to utilize more time and resources, which again, you have to make the most of what you have and be realistic, okay? So assess as many topographies as possible, but eventually you might just have to start writing, okay? However, what you don't want to do is just assess one and move on. You can't assess all at once. So the best approach is going to be take each topography and look at them individually. Your client just started playing basketball at his school. You ask the parents how the first practice went, and they tell you their son has developed a limp during the first week of practice that won't seem to go away. How should you respond? So super common especially when you start building relationships with parents, they'll start asking you stuff like this or telling you stuff like this. Now, they might just be telling you about practice, right? But if they're looking for you to do something behaviorally with the limp, how are we going to respond to that? Okay, what is our first go-to when we hear something like that? A, conduct a deeper indirect assessment through a health screener assessment. First, should we use any sort of health screener assessment if we're not trained? We should not. Second, is a deeper indirect assessment really going to help us figure out the limp on the son because of basketball? No. A is just not a very good choice. B, conduct a direct assessment at basketball practice. Now, you could possibly do that if you get permission and consent, but if the son already has the limp, maybe the occasion already happened, and continuing to practice is just continuing to further the limp, right? You might miss that opportunity and might not see anything, okay? But even then, it's a limp. What are we saying here? Well, it's going to be some sort of health thing. So before we want to intervene, we should do what? Well, we should recommend the parents consult a medical professional. We always rule out medical first, okay? Because if it is medical, no matter what behavioral things we do, we might not have a chance to change it. Now, if we can identify it's medical and then implement behavioral tactics to assist medical professionals, that's even more ideal, right? But if we know we were limping or we're hurting or something, always, always, always eliminate that medical reason first, and then we can get into other options. D, conduct a full functional analysis. You don't really need to conduct a full functional analysis here, okay? It seems the simplest explanation. He heard it during basketball practice would probably be parsimonious, right? He just started playing. He's limping. He might be sore. He might be hurt, right? So the first thing we want to do before anything else is recommend that parents consult a medical professional. You're taking data using a momentary time sampling procedure. Each interval is 25 seconds. When would the behavior need to occur to count as a response? All right. If you are getting ready for the BCBA exam, please, please, please understand the basics fluently. Things like momentary time sampling, continuous measurement, interval recording, stuff just has to be second nature. It has to be so easy to you, okay? If you're struggling with these questions, you're going to have a hard time with the harder questions, right? This question should be fantastically easy, right? You should love this question on the exam. It means you just scored a point. And as we know, all that matters is how many points you score on the exam, okay? So every point counts, right? So you're taking data, momentary time sampling. What does that mean? Well, with momentary time sampling, we're looking at our interval. And at the end of that interval, we are checking to see if the behavior is occurring. In this case, each interval is 25 seconds. So all that considered, when would the behavior need to occur to count as a response? A, at any point during the 25-second interval. What kind of sampling or recording is that? It's going to be partial interval, right? If it has to just occur during the interval for 1 second, partial. B, the entire 25 seconds of the interval. That's going to be whole interval recording, right? And if you don't know this, you have to go back and get fluent on this stuff first, okay? C, at the end of the 25-second interval. Yes, that is what momentary time sampling is. We're looking at the end of each interval. Is the behavior occurring? Is it not? Boom, marking down the response or the non-response. So when would the behavior need to occur to count as a response? If we were using a momentary time sampling procedure at the end of the 25-second interval. You're at the end of the baseline phase for a research project you're conducting. The day you're about to start intervention, the client breaks their arm. What should you do? Clearly, the client breaking their arm could be a serious extraneous variable in your project. Luckily, you're just at the end of the baseline phase and you're not quite starting intervention yet. So what should you do? A, determine if medical treatment can be withheld during intervention. Now, the client broke their arm. Ethically, we're not going to try to withhold treatment for a broken arm. Okay, that's very unethical, violating dignity, all the above, right? A is just not a good answer. B, continue your baseline phase as your client receives medical treatment. Yes, all that previous baseline data, okay, we have to check to see how much their client breaking their arm has really affected them. If you're doing like a reading intervention, maybe the broken arm doesn't affect them at all. But if you're doing some sort of gross motor or writing intervention, could affect them quite a bit. Okay, so you'd want to continue your baseline just to get an idea of how is this broken arm really going to impact your research. You might have to put it on hold till later, right? C, allow the client medical treatment and start your intervention phase. Well, you don't want to go right into an intervention because the intervention is going to be already different from baseline, and that's not what you want. Okay. D, start your intervention phase no matter what. No, you want medical treatment. You want to make sure your data is still valid and accurate and reliable, even with the broken arm. If it's not, again, you might just have to hold off for a while until that arm gets better, reintroduce, restart. Okay, so what should you do? Continue your baseline phase as your client receives medical treatment. How should you describe work responsibilities to staff and supervisees? Kind of an obscure question, right? But again, personnel management people struggle with. If you're trying to describe work responsibilities, what are you essentially writing? You're basically writing a target, okay? It's essentially what you're writing, right? You're responsible for cleaning the kitchen as part of your staff duties, okay? So how should you describe that to them? A, using subjective and ambiguous language. Would you ever describe a goal or a target to a client using subjective and ambiguous language? You would not. So don't use it with staff and supervisees. B, by explaining the consequences of not following through. Well, consequences is kind of a loaded word to begin with, but are we going to be punishment first? No, we want to just tell them their responsibilities, not, hey, if you don't do this, this is what happens. Okay, you're already off on the wrong foot. C, you should operationally define the behavior. Absolutely. Same thing you would do with the client. Operationally define that behavior in a way that everybody understands and everybody can target. And then D, using complex jargon. We want to avoid complex jargon whenever possible. Keep it simple, keep it objective, keep it measurable. How should you describe work responsibilities to staff and supervisees? C, you should operationally define the behavior. Finally, BCBAs are allowed to engage in romantic or sexual relationships with current clients only if what? Now, be careful. Are BCBAs ever allowed to engage in romantic or sexual relationships with current clients? No, okay? Never, ever, right? If the client terminates or you terminate, you still have to wait 2 years. But current clients, not at all. So A, the relationship is disclosed to human resources. Nope, still not acceptable. B, the relationship is disclosed to the BACB and the human resources. Nope, still not okay. C, the BCBA works less than 10 hours a week with the client. Still not okay. You just can't do it. D, BCBAs are not allowed to engage in romantic or sexual relationships with current clients. You can't do it, okay? Current clients can't be involved whatsoever. If you get involved, you have to terminate. You have to handle it. All right, thanks for watching. Check out bcbastudy.com for all of our study materials. Like, subscribe, join. Questions, comments, let us know. Work hard, study hard. See you soon.